All right, good afternoon, everyone, and thank you for joining us for our Healthy Transitions Colorado March webinar. My name is Kristen Paulson with the Center for Improving Value in Healthcare, and I'm very happy to be here with you today as we discuss care transitions and health information exchange. Button. So Civic is the managing partner for Healthy Transitions Colorado in collaboration with our partners, CFMC, the Colorado Hospital Association, Colorado Healthcare Association, and Colorado Rural Health Center. Healthy Transitions Colorado is a collaborative effort focused on aligning and accelerating existing efforts to improve transitions of care for Coloradans. Our guiding principles are simple. By working together to break down the silos of healthcare, we can foster true community care coordination across facilities, specialties, and practices. HTC coordinates the tools, resources, and efforts of many partners across the state. We want to keep Coloradans healthy so they can enjoy more of what our beautiful state has to offer. Our goals for the campaign follow the triple aim. Over 2 years, we hope to eliminate 8,700 readmissions across Colorado, which will save over 34,000 days in the hospital and $80 million for Coloradans. If you haven't already done so, we'd like to invite you to become one of our community partners and take the pledge to improve patient care transitions. To take the pledge and learn more about HTC, colorado.org. So we have just a couple of housekeeping things before we get started. The phone lines have been muted and will remain so throughout the webinar. We are going to be using the chat feature available in the lower left-hand corner of your screen to field questions and allow you to make comments on the discussion. Any questions posed to the presenters will be answered during the question and answer session at the end of the presentation. The webinar is being recorded and will be posted to the Healthy Transitions website so you can get access to this information again at any time without a cost. I'm now going to turn the presentation over to Pamela Russell, the Development and Outreach Manager at the Colorado Regional Health Information Organization, or CORIO, and Drew Curry, the Senior Manager of Business Development and Outreach at CORIO. Pam?
Thank you so much, Kristen, and I'm so happy to be here today to present your monthly webinars. And again, we do partner you with all the Healthy Transitions efforts, and again, we thank you for inviting us. The agenda today, I'll talk a little bit about CORIO, and then I'm going to, right off the bat, show a short video on the LTPAC program. I believe once you watch the video, then as the rest of the presentation progresses, you have a better understanding of what we have. I'll also go over how health information works, some of the participants, and then focus on the LTPAC Long-Term Post-Acute Care Grant. So right off the bat, picture of me. Don't you love taking pictures? But here's Pamela Russell and a little bit of my background. When this first grant came up, I worked closely with some folks that were currently at CORIO that knew that my expertise was in long-term care and it's in disease management. It was in so much, and they said, we have this grant. We know the IT experience may not be there, but we definitely know you understand the whole long-term care arena. So I was so pleased to be joining CORIO to be able to manage this long-term post-acute care grant. So CORIO is a nonprofit public-private partnership. We are what's called the state-designated entity for health information exchange in Colorado. There are 2 HIEs, CORIO, as well as Quality Health Network on the western slope. So back in 2009, it was put out by Center for Medicare and Medicaid and then the Office of the National Coordinator for Health Information Technology that every state should have a state-designated entity for health information exchange, and Governor Ritter appointed CORIO as the SDE back in 2009. So our vision is like everyone, the triple aims: right care, right time, right place. But our goals for 2015 include that 85% of all providers are meaningful users of electronic health records in Colorado, and that HIE is deployed in every community. So what does that mean? CORIO is a public HIE, health information exchange. CORIO is a nonprofit public HIE, which means our mission and purpose is more closely tied to serving the public good. Private HIEs are often aligned with business entities and tend to serve that purpose only. But it's not an either-or situation necessarily. Both public and private HIEs can coexist successfully because they each meet different needs in the community. I'd like now to switch gears, and we're going to show you the video. The LTPAC, the Long-Term Post-Acute Care Challenge Grant, which began in early 2011, our goal was to adopt skilled nursing homes, assisted living, home health, hospice, and LTACs, long-term acute care hospitals, to join Creo and have access to what we call Patient Care 360. And we'll now begin the video. Thank you, Kristen, for showing that. I do want to recognize Jennifer Mensch, who was behind getting this video put together. And we really did not have scripts. We literally went out and interviewed our different participants. And many of these providers, as you can see, were from the Boulder area. Boulder Community Hospital was one of our first hospitals live with Creo. And then we were very active early on with getting many facilities also in Boulder area. So that's why they were, so they were there. So they had already been using it. They've been using it for at least a year, about almost 2 years. So when we talk about communication challenges, we talk about when paper medical records come with the patient, instead of being available in the hospital's electronic system, care transitions are not as smooth as they could be. So for the LTPAC providers, the skilled nursing, home health, hospice, being able to have the ability to not look at the community health record at the hospital, but to be able to also, when a patient then is also returned back to the hospital, if we can also put that electronically as opposed to copying and copying a bunch of papers and medical records and sending them with the patient along with the ambulance driver. I'm going to get into that later on in this presentation. So another challenge certainly is communication challenges. So when a patient's either a home health nurse or the nurse in the skilled nursing home, or even in the hospital setting, being able to rely on the patient for their memory and understanding of the condition can lead to information gaps and lead to duplication of treatment. And again, it's ordering up new tests, be it when they're from the medical director at the skilled nursing home having to order up new labs, or even in the hospital ordering up labs and tests. That being able to not have that happen and reduce costs is one of the key components of what we're trying to do here at Creo. Another communication challenge is faxes, and just like Georgia Berger had stated, faxes can be slow and smudged or missing, and they can go to the wrong location, compromising patient privacy. You look at the cost of the paper toner and staff time to manage faxing can be expensive. Another challenge is the good old phone calls. I love this picture. But again, even when and a lot of patients are discharged from hospitals Thursday nights, Friday nights, Saturday morning, it's very difficult to do follow-up phone calls and leaving messages, trying to get contact to say, oh, there was a swallowing valve done on Friday. What are the results? We need to be able to feed this patient today. What's the dietary restrictions and so forth. So communication can be a real challenge. So how can Creo meet these communications? Well, we improve workflow in finding patient medical records. Every long-term care provider that is signed on with Creo has access to what we call the community health record. And the hospitals that are signed on in Colorado, and we have many, they're able to then access the same information that flows into hospitals' EHRs. The hospitals use either Epic, Meditech, or Cerner, and Creo is successfully integrated with all three of those EHR systems. So it's in real time, so whatever flows into the hospital record automatically flows into Creo. So the LTPAC providers, including the physicians, skilled nursing homes, so they have that ability to look at the patient's records 24/7. So it can also eliminate unnecessary work when preparing it for a new patient or when transferring a patient. Again, we're not wanting a lot of copying and paper printing that is done. We want to be able to do this electronically. We do, we feel, improve the clinical decision-making by providing more accurate patient histories and clinical notes. And again, the integration seamlessly with existing systems has been one of our greatest. So how does HIE work? The clinical perspective, before HIE, you see a physician or a nurse, someone sitting there in the middle, and they have many paper and phone-based interfaces, as we call them, or how are they contacting with all the people out there in the world, and they need all this information to take care of their patients. So they have limited electronic connections. But with Creo, there's one electronic connection to the HIE to access and share the patient information. So the hospitals right now are data senders, and all the data receivers would include the LTPAC providers, the behavioral health, home health, hospice, and so forth. So there's when we talk about having the interface and being able to just have the one connectivity, it does help that hospitals have multiple interfaces. Maybe the physician offices may have multiple interfaces, which could be to a lab and then to a hospital and so forth. And we're trying to simplify it so that the care transitions can move along quicker, seamlessly, and faster. I love this ice cream cone slide, but the flavors of HIE, there's three, and Creo supports all three types of these data exchanges. First is the results delivery. This is where the patient data is automatically routed to the appropriate provider's EHRs or the web portal inbox in real time. And this is where I spoke that when you're on, we call our HIE Patient Care 360, having that ability to have the results delivery go into the HIE. And it's called query-based, which actually now you search for a patient and retrieve the comprehensive consolidated information, which is really the longitudinal health record. So it is a query-based right now. And our newest is the direct point-to-point, which is a simplified version of health information exchange, but it works a lot like email. It is HIPAA compliant and secure, and it's also specified in meaningful use objectives. So many hospitals, eligible hospitals as well as eligible providers, have some requirements and meaningful use in the stages, and it's under the transitions of care, which goes right along with this care transitions, but being able to transfer this information electronically. So we're also helping the hospitals and physicians also to meet their meaningful use objectives. So what is the community health record? Those that are signed on, when you open up the system, it's called Patient Care 360. This is after Creo has signed agreements, which are called participant agreements, business associate agreements, with all the providers out there. And then we give username and passwords. So we control everyone that touches this community health record. It is auditable. So we know every person that looks up a patient, the patient name, the time. We have different systems in place to make sure you're not looking up a family member with your same last name or so forth. Because we get asked a lot of questions, how safe, how secure is this community health record? And we talk that our help desk that is available 24/7, the policy procedures that we put in place, the high-tech HIPAA language that we go over with all of the providers that touch Creo and let them know how this is very serious, it's patient information, and when you access this, if anyone has seen a demo, and we can certainly do a demo at another time, but you actually go in, and if you don't have the relationship with the patient, you do what's called break glass. And again, I'll let you know that this is it could be jail sentence, it's a penalty. So we actually have a lot of procedures in place to make sure that the person who's opening up the security health record is the person who needs this information to take care of the patient. So with Patient Care 360, you can access the face sheet, ADT information, histories and physicals, transcription, lab, path, radiology, and then the ability to create what's a summary of care document. It's called a continuity of care document in Patient Care 360, but it's really a summary of care document. We talk about how the query-based HIE works. Well, what's in there now? In our current state with Creo, we have hospitals as the data senders. So they're sending in all the hospital ADT info, consults, transcriptions, lab, rad. We also have Public Health Department, CDPHE, sending in reportable conditions and immunizations and newborn screening results. We have laboratories sending in lab results, pathology. We also have radiology centers sending in radiology reports. So that is our current state. And as you talk through, I think, the future state, you have to kind of keep hitting, and the future state will keep coming up. So we're connected with CIIS to be able to share the immunizations and the public health alerts. We're working with pharmacy to get pharmacy information and medication lists. We're working with Colorado Telehealth Network to have the ability to have diagnostic quality medical imaging inside Creo. The immunizations also will flow in. Orders is a big one we get asked. When is that coming? That is in our future roadmap. The CCD upload, the continuity of care document upload, which is again is going to be part of meaningful use. And the big kahuna at the far right is the data analytics. Everyone wants that. And when we have all this information, what do we do with it? And again, that's all in our future world. So let's talk about data senders versus data receivers. Our data centers right now, like I say, are the health systems. But Centura Health System, Health One will soon be live. Exemplar will soon be live. So we have university system. We have health systems out there. We also have independent hospitals that are live and are the data centers. And then we have national labs that are also the data centers, meaning their information is flowing into the HIEs. Then you have data centers versus data receivers. Well, then who are the data receivers? And again, we can't have any data receivers without data centers. So it's always the cart before the horse. So when I first started this back in 2011, I was a little bit of ahead of myself because not all the hospitals were live. And again, we've got people wanting to sign up, but if there's no information, there's no benefit. So we've grown a lot in the last 3 years working on all this. But currently our data receivers are the physician offices, the skilled nursing homes, home health, hospice, long-term acute care hospitals. Right now we have Craig Hospital as our LTAC. Emergency medical services, very interesting, being able to have the EMS providers on, the emergency physician groups, the behavioral health centers. All of these are called data receivers. And with the skilled nursing, I do want to say it was wonderful. Fraser Meadows, who was in that, was one of our first skilled nursing homes to sign on. They've been a wonderful partner. For sure, the Sava Care Centers, North and South, Life Care Centers of America, Vivage Quality Health Management, Continuum Health, which has Grace Point in Greeley, and Charmore down in Pueblo. So, we just had such great support from the skilled nursing homes. And then with home health, professional home health, and Complete, and the ones that just were with us from the very beginning and were able to come back and say, well, I wish you could do this, we wish you could do that. We have like user groups, and they say this is what needs to help. But it's having those groups that signed up, being able to let us know how we're doing is the only way we've been able to move forward. So where's Creo today? We have 48 hospitals signed on, 31 connected, and that means that represents 94% of all hospital beds in the region are connected to Creo. For the long-term care facilities, 126, and it keeps rising. The physicians, we have 1,466 connected, and that means they are both connected for full EHR integration with their EHR, as well as perhaps just have Patient Care 360 only. But overall, we have over 2,200 office-based physicians signed on. And we have almost 3.4 million unique patients in our database, which is 64% of the CAUTO's total population. So we meet with the ED departments, emergency departments. We let them know that there's a 1 in 2 chance if whoever hit in their ER they're going to be able, that ED department is going to be able to pull down that patient's name and look at the disparate system. So if they're at, Centura Hospital, they can see they were at Boulder Community, or if they go to a university, that they can look at if they just came up from Memorial or Parkview in Pueblo. So being able to have that ability to look at the disparate systems, again, in the ED department, they're not going to order up tests if they realize, they were just at this other ER 2 days before. Now they have all the information at their fingertips. We're really proud when you look at the hospitals that are connected. We put them by systems. You see our early adopter, Centura Health Systems, was awesome. They were live in October of 2011. Boulder Community Hospital was live in February of 2011. San Luis Valley Regional Medical Center was live in August of 2011. So we had many that were live in 2011, and certainly a lot more that came on board in 2012. 2013, and as we look forward to 2014, in the summer, we hope to have Exemplar and Health One systems live, as well as many of the critical access hospitals out there that are in real need of being able to have all this information. Many times the patient may go to Estes Park, but then it has more urgent needs and then may need to be transferred down to University or to a hospital in Denver. Being able to transport that information so that you're not ordering up new tests and labs and so forth, again, saves a lot of money. The labs that are participating in, that are live, are Colorado Lab Service, LabCorp, Quest Diagnostic, which is also connected with the 9 health fairs. There's the ability now, if you go to a 9 health fair and you have labs taking cholesterol, glucose, something that's done, you'll sign paperwork that says that 9 health fairs is now connected with Creo, and you would have that the ability to then have this information shared with your physician if the physician is also signed on with Creo. Schreiber Medical is also with a lot in the long-term care facilities. That should be live anytime now. And Cedar Diagnostic has signed on the contract. So let me quickly talk about the grant. The Creo's, it was a long name, but it's called Creo's LTPEC grant. So it's the long-term post-acute care challenge grant to improve care transitions and reduce hospital readmissions by 5% through health information exchange. Well, the title alone tells you that's why it's called a challenge grant. We're challenged to even see if I can say all that, but also we challenge to see are we even able to do that. So the targeted communities back in 2011 were Boulder County, Colorado Springs, Pueblo, Canyon City, and San Luis Valley. We then added Metro Denver in the spring of 2013 and when we talk about that, and the grant basically provided all of these providers this Patient Care 360, this HIE product that we call, 2 years at no cost. It was a pass-through money, but at least to get them on without having them to outlay any money, for them at least to try and give us, they're part of a research grant to tell us how is this working. The three principal components were to, number one, encourage the participation in the community, and then also to define and implement community goals and process and protocols for the LTPAC transitions, and also to integrate with existing community advisory boards, and then to develop a statewide template and standards for improving LTPAC transitions. But our Partnership for Success, again, I want to give a big shout out right off the bat to Civic. They were with us in the very, very beginning. Colorado Foundation Medical Care, the state's QIO, the Colorado Healthcare Association, Colorado Hospital Association, the Colorado Rural Health Center, Dr. Cog, AAA, Healthcare Policy and Financing, HCPA, Quality Health Network, QHN, and other existing community initiatives in Boulder, San Luis Valley, the Springs, Pueblo, and Denver. So when we started out, again, with the grant, we really wanted to say, well, how could you improve workflow, and can you really quantify this? We were able to do workflow improvement. When we first, when all the providers are signed on, the LTPAC providers, we had them, they filled out what we call the HIT assessment pre-workflow survey. And so we asked them a lot of workflow questions. And one big key question, what is the average time spent locating patient health records now? And the average time was 29 hours and 46 minutes. Once the staff was then trained on Creo's Patient Care 360, we did a 30-day post follow-up and said, well, how is it working now? And at 30 days, it was down to 11 minutes, 42 seconds. And then at a 60-day follow-up survey call, it was down to the average time spent locating patient health records was down to 6 minutes and 30 seconds. So Creo saves LTPAC practices an average of 29 hours per admission. And again, this is when we can be able to really actually show how this helped and how the data helped. This is a very valuable and powerful slide to show how care transitions can really work. The Challenge Grant, which started in January of 2011 and then ended January of 2014, is in the process right now of doing an evaluation. We do have some early numbers to share. I will say that usage, which means when the providers sign a contract with Creo, and then you identify the users. Are they really using it? And you'd see many articles that physicians would sign up for EHRs, and it kind of just sit as this app on their laptop and on their computer. We really wanted people to actually use it. So we actually made that one of the milestones of the components of this program. And I will say that it was probably one of the key points that we put into this milestone because it was the most successful. I mean, we found that even though we may have turnovers in skilled nursing facilities, home health, with the users, we were able to monitor that, keep on top of that. And actually the number of core users that are involved in the LTPAC program right now, and this is the current number, how many are using it now, is 7,815. It's a large number of users. And with that, 75% of that number are actually using it on a weekly, monthly, daily basis. Another monitor or milestone we wanted to look at was queries, meaning are they really actually going in and querying their patient to be able to take care of this patient? And in the LTPAC program, our queries are at the 1 million mark. So yes, they are definitely using it. Another milestone in our Patient Care 360, we refer to something called the CCD, Continuity of Care Document, but we really like to refer to it as a summary of care report. But the ability for the facility to create it, print it, there was consumer patient engagement was a huge part of this challenge grant. Do the consumers and the patient actually have the ability to access their health information from the hospital? and we hit that milestone at 100% of all of our providers have the ability that if, upon request, if the patient or their family member who has medical release wants to look at we call the continuity of care document, which is that summary of care report, and so maybe they're at a skilled nursing home with total hip replacement. Now it's the first trip they're going to their PCP, that being able for them to have the hospital record right there in a very short period of time is very, very beneficial. So the encouraging numbers so far, and stay tuned, we'll be publishing the results soon, and I'll be able to speak on the LTPAC program. But our next, what I want to touch on is the direct messaging. You hear a lot about it, and Carrillo is actually one of the leaders actually in the nation right now, as we are a HISP. I'll talk about that quickly, but it's a health information service provider. So Carrillo is able, as a HISP, to be able to give these direct email addresses out. Let me go back to that. But let me explain. What is direct or directed exchange? It's a basic type of health information, HIE, that allows a healthcare provider to securely send patient information directly to another specified healthcare provider or even a patient. This information is sent over the internet in an encrypted, secure way and is commonly compared to sending a secure email, and direct messages are HIPAA compliant. So what do you need to use direct? When you're signed on with Carrillo, we then have the HISP service that allows you to send and receive direct messages. Carrillo then would give you the direct address. You have what's called a direct address. And then the messaging software could be use your own EHR or a standalone software tool for messaging, which Carrillo can provide. So with this direct, on a national basis, and actually with ONC, this was something that a lot of states adopted with direct. Carrillo actually, in the beginning, we actually focused a lot on the community health record, and then have moved into the direct, last fall, and it's just, and it's going very, very strong. We've got some ideas. We've talked to a lot of different hospitals and so forth to talk about this. But a pilot, we actually working with CFMC on a pilot. So I want to quickly, back in November of 2012, actually it was October of 2012, CFMC was awarded a one-year contract by CMS. There was 3 QIOs in the country that were awarded these contracts, and the contract was basically to see if you could improve care transitions of communities through health information technology. And I work closely with CFMC, Pam Valvano, and Meredith Koob. I'll throw props out to them to say, well, can we do this? And our focus area was northern Colorado with Greeley and Fort Collins. And we collaborated to see, our goals again was to improve care transitions between skilled nursing facility and emergency department. We also would, so in order to do all of this, we then certainly had to have the community's time and effortness. And again, we really appreciate the community helping this. We have care transitions meetings going on both in Greeley and Fort Collins. And having the support of the hospital, having the support of the skilled nursing homes was key. So in the Greeley direct messaging pilot, I worked closely with Grace Point and Fair Acres. And at Grace Point, Betty Fowler is the health information manager from Grace Point, was so kind, and Fair Acres, it was Ben Gonzalez. We did some training with them. We were able to give them both direct addresses. Then both Drew Curry and I worked very closely with Banner, with the IT department there at North Colorado Medical Center, in that getting emergency director having key folks in the ED department, and they would give them direct email addresses and do training. So I'd like right now to turn it over to Elizabeth Fowler, who just will give you just a brief summary of how it went with Grace Point.
Elizabeth, are you with us?
Yes, I am. Yes, thank you, Pam. We were involved in the pilot project the last week of January, so any residents that we were going to send to the hospital between the hours of 8 and 5, we called the ED department ahead of time with a designated phone number that they had given us, and then we would send the email with the attachment. At that time, we had just our transfer discharge form from our electronic health record. But we have point-click care, and since then they have integrated the SBAR tool and probably by June or July, all the Interact tools will be available on our point-click care system. So we're going to attach those as well. And we do have a meeting set up with NCMC, North Colorado Medical Center, next week because we want to continue this secure email so we can get the information there before the patient arrives at the hospital. And I think it's going to be an awesome relationship and a partnership, and hopefully we'll set the stage for this to be across the state and across the nation to help with patient care.
Oh, thank you so much, Betty. Thank you so much for that. And again, I will go back and thank Grace Point and Fair Acres and Pam Valvano and Meredith Koo from CFMC. This definitely was a whole community effort. It continues to be refined. It's manual, but again, we need to test and see how it's going to work. We talked a little bit about the HISP. And Banner has Cerner, and they're going to be a HISP, and then once they're a HISP, they'll connect to Creo's HISP to HISP, and this information then will be automated. It won't be a manual process. But we find in the emergency department having just, instead of knowing that the paperwork, even though and the skilled nursing homes do an awesome job of printing everything and they can, then we'll maybe go to the ambulance driver, and then the ambulance gets the patient into the ER, and then by the time they get back to a room, what we hear from the physicians and the hospitals and so forth, they just don't see that paperwork. So they're still picking up the phone call and the skilled nursing home. Well, what is the the vitals? What is the most recent information on this patient? So being able to have it so that when it gets sent from the skilled nursing via direct, and then it needs to be uploaded into Cerner, that way the physician there actually has all the information that just happened in the skilled nursing facility. So again, more to come on that, but we are very, very excited about the Greeley pilot, and I can't thank Betty Fowler for being on and letting us know how a true example of us trying to work on that. So that concludes my presentation, but I would like to open it up for any questions that anyone may have.
Great. So once more, we're going to be managing questions through the chat feature. So if you have any questions for our presenters, please put them in the chat box, and we'll get them to Pam and Drew. We have one to start off with. This is Lynn Kassman. Wanted to know, they use the EMR. How do they connect with the HIE?
I'm going to let Drew Curry go ahead and take that.
Okay. Thanks, Pam. The two ways that a facility can connect. One way is into your EMR, where we can push the results. The other is through the portal that you've seen today, Patient Care 360. The portal does not require an interface. The integrated model does require an interface. So if you wanted to go that route, you'd need to contact your vendor, and we could have that conversation with them also to talk about connectivity. Then there's the paper process. We have to go through and sign the participation agreements and the business associate agreements, and then the actual implementation. Implementation of Patient Care 360 is something that can take probably 4 to 6 weeks. It's not a long process. The integrated model can take longer depending on, especially if we've worked with your vendor before, but that process probably takes more like 9 to 12 weeks. If you have interest in connecting, Pam's contact information is on the slide. You could send her an email, and we could get the process started that way.
Great, thank you. So next two questions actually go together from Aaron Burge. What is the name for the Western Slope Exchange, and are any providers using this on the Western Slope?
Yeah, QHN is Quality Health Network. They started in 2004. In fact, Dick Thompson, the director there, QHN, is on our board at Creo. We work extremely close with them. They are very successful. They have St. Mary's Hospital and Rocky Mountain Health Plans as a partner of theirs, and they have Mary Brown will correct me, but I just heard her speak last week, but I believe all the hospitals on the Western Slope are connected to Quality Health Network. And then physicians as well, they've hit the numbers too, I believe, of 85%. And they also work in some with the long-term care centers. So we try to mirror each other because, again, we work so closely together.
Great, thanks. So next question from Peggy Budai. Sorry if I'm butchering your name. When do you estimate that this information will flow directly into the EHR when sent from one setting to another?
The answer to that depends on what setting you're talking about. If we're talking about sending data from a hospital to a physician office, we can already push that information directly into the EHR in the physician office. If you're talking about physician office connectivity where physicians are sending information back and forth, that would happen now using the direct tools that Pam's been talking about, where each office would need to be set up with a direct email address and be able to send information back and forth. That information currently is not captured in the community health record, and Careo's function in that right now is just to move the information back and forth. It's in our development plan that we would capture that information to also become part of the community health record.
Great, thanks, Drew. So from Cheryl, Knalikan, does the University of Colorado Health System have a current contract with Careo?
The answer is yes. The entire health system is live as a data sender. The system went live in pieces as it was being built. So Poudre Hospital went live, I believe, in December of 2011. I think that's right. And other parts of the system went live. The University Hospital itself went live, I think, last June. But the entire system is live now as a data sender.
Great. So another question from Jamie Caldwell. Immunizations are included in our CDA. When we begin sending our CDA to you, can you then parcel out the immunizations and send on to CDPHE? We want to avoid point-to-point interfaces for the public health MU requirements.
Well, good question. The answer is not yet. So if you send immunizations as part of a CDA, we can move the entire CDA, but we cannot parse the information out yet. That is in our development plan. Careo does have interfaces with CIIS, so we can extract the information from your EHR and push it to the immunization information system.
Great. Did we have any other questions from our participants? Okay. Yes, Pam?
This is Pam Russell. I just was going to add a thing back to the direct messaging, because one of when we talk about community advisory groups, I want to, again, do a shout-out to Pat Critchfield from Boulder Care Transitions, and certainly in Fort Collins, and Peggy Vidai is key there, and as well as in Greeley and Kathy Kimball at the hospital and others. When we talk about care transitions, and again, what everyone's talking about, too, is we want the information out from the hospital to the facility and vice versa, but some kind of standardization. What would that form look like? And there's a lot of different core and key data elements that need to be in transfers. And that's when even when Betty Fowler was talking about that, what is she attaching now with Direct? We talk about the Interact tool or the SBAR or the most current med list or whatever can be attached. The attachment is easier, but again, we're just like Drew said, we're the post office, and we were just transporting that. And certainly the next goal would be how do we integrate that? So in working with the hospital systems, when they have their discharge summary notes, we want to be able to put that in some kind of some kind of a standardization form, and that's something even Pam Valvano was working on early on. What would it look like? And everyone wants it. The physicians want it. The skilled nursing home, everyone wants it. And I would say that is something that we should all be, working together for to see if we can get some kind of standardization on these care transitions that the information is transported. At least everyone knows they're looking at the same thing.
We have another question on chat from Jamie Caldwell again. Will the CDA sent to Careo get an acknowledgement back to our EHR, and does it qualify as a different EHR? They're thinking.
Careo is a HISP, and that means that we would be able to send an acknowledgement back that we had received the CDA. I believe the answer to your question is yes, it would qualify, but I reserve the right to get back to you with an appended answer.
And that is Jamie from San Luis Valley Regional Medical Center, who, again, early, and thank you for that. So,
from Laura Palmer, Is video or telehealth technology available through Coreo?
I'm not sure I understand the question.
Like our patient call it telehealth network?
So I think
Video,
I'm going to
telehealth
field this question real quick. Coreo is primarily focused on the health information exchange, the data exchange between and among EHR. Video and telehealth is primarily handled by the Colorado Telehealth Network and other networks across the state. And thank you for teeing this up, Laura, because we are looking at having a webinar from one of our telehealth providers in the next month or so, so keep an eye out for that. So not as much information about telehealth today, but we will have that upcoming as an HTC webinar in the very near future. So thank you for that. So if there aren't any other questions, I would like to thank Pam Russell and Drew Curry again for sharing their expertise with us today. And thank you everyone on the phone for joining us. I hope it's been a valuable use of your time and that you've gained some information that you can use to further your care transition efforts. Pam's contact information is up on the screen. If you have any other questions, you can also contact me through hello@healthytransitionscolorado.org. Again, this webinar has been recorded and it's going to be available on the HTC website in the next few days. So thank you very much for joining us and have a lovely day.
Thank you.
Thank you.